Hello, everyone. I'm Steve Nicotopoulos from CAN-TV. We're doing a special episode today of Understanding Healthcare. This is a show brought to you to discuss the new Affordable Care Act, and it's sponsored by CAN-TV. We're going to cover a series of topics over the next 25 minutes, so please feel free to call in. The number is on the screen below, 312-738-1060, and we'll start taking your calls in just a few minutes. Today we're joined by Jessica Palys, who's here to help us figure out all of the complexities of the Affordable Care Act and try to help explain a few things. Jessica, thank you for being here.
Thanks for inviting me.
And let me put your information up. Now, you're with the Campaign for Better Healthcare. Mm-hmm. And, of course, you guys are online at cbhconline.org. And there's a phone number there to reach you as well. Can you talk a little bit about what Campaign for Better Healthcare does?
Sure. The Campaign for Better Healthcare has been around for about 25 years. We are an advocacy organization that has fought for healthcare reform for those 25 years, both with Medicaid expansion, Medicare, an HMO Bill of Rights are some of the victories in our history. We fought for the Affordable Care Act as well as the Healthcare Justice Act, which was a state-based reform effort before the Affordable Care Act came around. And now we're working on signing people up for the Affordable Care Act.
Okay. And you are a in-person counselor. Mm-hmm. What are the kind of things that you see week in, week out helping people with this?
I see a lot of people who don't know where to start. When you get started, the easiest way to do that is go to getcoveredillinois.gov. The Affordable Care Act was designed to have the federal government could facilitate it, the state government could facilitate it, or they could partner and facilitate it together. And in Illinois, we have a partnership. So the state manages the Medicaid program, the federal government manages the marketplace, and there is a landing page that figures out which direction you're supposed to go. And that's getcoveredillinois.gov. They ask you a series of questions that are blind questions. You know, do you live here? How many people in your household? What's your income level? Where do you get your income? And then they direct you one way or the other and to start your application. So that's the easiest way to start.
Okay. And it's basic to say that the way to look at getting health care coverage is based on if you earn a certain amount of money versus your actual age. Can you talk about some of the different categories that any viewer might fall into with how they should think about where they should go to get coverage based on their income or their actual age?
I don't know if age is that relevant, although the cost of healthcare changes based on age. The healthcare plan under the Affordable Care Act can be priced only based on your age, where you live, and how many people in your household, and your income, and so and whether or not you use tobacco. So those are the things to take into account when you sign up. A household would be defined as people who file taxes together. So if you have an adult child living at home who files taxes alone, that would not be a member of the household. That would be an individual who files taxes. He would be separate. And so say there's parents that have a 28-year-old living at home, and 28-year-old has a job and files taxes on their own. That person could buy coverage on their own. The adults would buy coverage separately, and it would be a household of two for the parents and a household of one. So it streamlines up with your taxes, how you file taxes.
Okay. Now, in general, why is it important to have health care coverage?
Well, I don't think that most people realize how expensive healthcare is unless you're actually someone who has a health condition. And a lot of young people especially don't realize that one accident, one burst appendix, one broken arm, or other, bad illness could land you thousands and thousands of dollars in debt that you would be paying off for several, years to come. I mean, they were talking about $50,000 and, $75,000. There are medical costs in the United States have been growing for like a few decades now. Part of that problem resulted from the fact that we had a system that was so broken, and so the hospitals that were bearing the brunt of the costs for emergency care that was uncompensated had to take those costs and put them onto the bills of people who are insured, and that's part of the reason our costs have been growing. And they have slowed now since the Affordable Care Act, but they are not yet it's still at thousands and thousands of dollars that you would think would not be that expensive to see a doctor, have an anesthesiologist, have a small procedure. So that's the main reason, to protect your assets, to protect your future and your livelihood, and to make sure that you can get the care you need when you do get sick.
I'm sure a lot of us have remembered the stories before the Affordable Care Act about how expensive some procedures or even dealing with certain illnesses
Right.
were for people. So this is an attempt to try to give coverage and even the playing field.
Right. It's also important to help you stay healthy. Under the Affordable Care Act, you're actually able to get your preventative care free. It's 100% covered by the insurance companies now. So your mammograms, colonoscopies, flu vaccines and other vaccines, any kind of cancer screening, cholesterol, blood pressure, as well as tobacco cessation and depression screening. Some of these kind of basic things to help you be a healthy person are all covered and incentivized for you to actually take action. Because, as young people or as, people in their 20s and 30s don't necessarily think about their health as an investment in the future, but it really is, and that's part of what is the aim of the Affordable Care Act.
Okay. One of the things we talked about, and I'm going to show a little overhead here to talk about one of the things that you have to do to qualify. Now, you must live within the United States of America, and you must be a U.S. citizen or national. Now, one of the things we were talking about before the show actually started was some of the complications when dealing with, if anybody out there watching is a legalized immigrant, if you have you immigrated to the United States and you are now legalized, there's been some confusion about what to say or what to share when you're trying to sign up. Can you just mention some of the things that you were talking about?
What we've been hearing lately as navigators is that the healthcare.gov system might get stuck. If you check that you are, say, someone who's come here and married, but you are still working on getting your naturalization complete, or you're here with a green card, a student with a visa, something like that, they ask for your alien number as part of the process and also your documents, but it might get the system sticky. So I would encourage anyone who is someone who has a immigration status that is lawfully present but not yet a citizen to contact a navigator and ask for assistance, because there are some tricks to making sure the system goes all the way through and that you're able to enroll in a timely fashion. And in the meantime, there is a lot of information. The immigration system is very complicated, and there is different statuses for every kind of immigrant. There are refugees here that have a different qualification for the Affordable Care Act than do lawfully present students, than do lawfully present people working on naturalization. There's a lot of little details that are explained at the National Immigration Law Center. They have a website that has a good chart and a lot of explanation about who qualifies and how.
Okay. It's good to know. Now, I'm going to go ahead and show the general phone number for people in Illinois to call, also a mention of the website. We'll go into the website a little bit later, but I want to showcase, just since you mentioned talking to a navigator. Now, there's many complexities to what's going on with signing up for healthcare. This phone number, 866-311-1119, is a good first step to getting everything sorted out. So you can call and ask questions. You can ask how you can meet someone in your neighborhood that will help you sign up, and you have some familiarity with that where you're out there meeting people. So I mean, you could really get any kind of question regarding anybody's specific life situation about how it applies to them.
You can. You can also apply via phone, although it's not the easiest and it's not necessarily the most recommended, because you'll establish an account online with a username and a password, and if you apply by phone, you don't create those details for yourself, and so capturing them later takes a little bit more paperwork. Whereas an alternative is you can meet with someone in person and work through the computer system together, and then go home with the information for how to access your account and what you chose, or you can stop at any time. If you have an appointment, that doesn't mean you have to go all the way through. You can go halfway through, see what your plans are, and go home and discuss it with your spouse or friends and family, or it's important that you check with your insurance company and check the provider directory and make sure that the hospital systems and providers that are incorporated are the ones that you are interested in continuing a relationship with.
And I'm sure most people would agree that if they had the time to sit down and talk to somebody who's there to explain it to them and help them understand the choices that they're making, it's probably a little bit of a safer bet anyways.
Right.
It's a little more of that personal touch.
Right.
Now, let me talk about some of the things that are actually parts of the benefits. Before I do that, I want to remind everybody this is a live call-in show. So you can call the number on the screen, 312-738-1060. If you have any questions about how to sign up for health care, the Affordable Care Act, We'll talk a little bit about Medicaid in a few minutes too. So, I mean, if you have any questions about these things, that's the purpose of this show. So it's an open conversation, and we're here to answer any questions you have. Now, some of the benefits that are being talked about. Now, there's a few different things that are very interesting to highlight. Now, there's 10 basic benefit categories that it seems like we talk about when we talk about signing up for the Affordable Care Act. Now, prescription drugs is something that a lot of people were interested in. Obviously, you have emergency services, you have ambulatory services. Mental health is something very specific. That is a category. Now, is mental health something that was not usually talked about with insurance coverage before?
Well, so there's different ways people got insurance in this country. They would get it from their employer, and that was not necessarily up to their discretion as to what was included. That was up to the employer. But if you were in the individual market, someone who was not insured by your employer, and you bought it for yourself, I don't know if mental health was often a standard feature of those plans. Usually it wasn't, and usually mental health is something that people who would like counseling or some kind of services end up not being able to access those services based due to cost. So having mental health included as a mandatory essential benefit in the Affordable Care Act is a huge win for people who are concerned about this. And it's not just mental health, it's also substance abuse and behavioral health disorders. All things that can get extremely expensive very quickly, especially if you have any kind of inpatient services that were prohibitive for a lot of, I talked with a lot of families before we got around to passing this bill, and they just couldn't get the services they needed because they couldn't afford them.
A few other things that mentioned now. You talked a little bit about preventative and wellness services. But we also have pediatric services too. So some of those with younger children or who have multiple children in the family might want to pay attention to the pediatric services offered. And then, of course, laboratory services and hospital visits. So these are all things that could really rack up a lot of expenses
Right.
if you don't have some kind of coverage.
Yeah, what's funny is a lot of people don't understand that, you know, in some insurance policies before the Affordable Care Act, you might have been covered for the hospital, but not for the ambulance ride. And you might have been covered for some parts, but not the lab fees or the anesthesiologist or something like that. So that's how the costs get so high so quickly. One trip to the hospital could be thousands of dollars. This is also, it's interesting that these 10 minimal essential coverages that are mandated through the Affordable Care Act is part of the reason that we had so many cancellation policies before the new year. It's because the insurance policies that people had in the past did not cover all 10 of these. And the insurance companies are not allowed to offer those policies or weren't allowed to offer those policies if they didn't cover all 10 things. Of course, the president relaxed that law for a year, so now people can still get a la carte health care for another year. But it's part of making sure that you're actually insured against financial risk and able to maintain your health in every way that you need to.
Okay. Now, let me ask you something about some people who don't earn a lot of money. There is something that we've heard about on the show, which is county care or Cook County Care, and we're broadcasting within Cook County right now on CAN TV. Let me ask you a little bit about what the difference is between county care and Medicaid. Medicaid being something where if you earn under a certain amount of money every year, you can have access to Medicaid as some basic health coverage.
The difference is right now mostly has to do with the provider network. The Medicaid program has run on a fee-for-service system for a long time, and my understanding is they were changing that as of December to something more towards an HMO style. But county care was a separate program with a separate agreements with different providers. And because it started last year, because Cook County was one of the 3 or 4 counties in the nation that got advanced funding to start enrolling people in Medicaid. And they continue to be separate provider networks. So people in Cook County still have the option to enroll in county care or in Medicaid. You just have to find a county care certified counselor in order to enroll in county care, or any navigator or in-person counselor like me can enroll you in Medicaid.
Now, what are some complications about trying to sign up for Medicaid and waiting to see if you get accepted and trying to make sure that you're on the right, whether it be the Affordable Care Act or signing up for Medicaid. What are some of the complications in the process of how long you might have to wait for this?
At this point, it comes down to income quite a bit. Income is confusing to a number of people who have fluctuating incomes. Perhaps they have a seasonal kind of lifestyle where in the winter they have not much income, but in the summer they that produces most of the income that makes up their yearly salary. The marketplace is judging your eligibility for tax subsidies based and for the program based on your yearly income. And they'll ask you, how much did you make or what is your yearly income? You could use your tax records from 2012, or if you're really early motivated, you already have your tax records from 2013. You can use those records as well. But then they'll ask you somewhere in the application, do you expect this to be the same income for 2014? Because all of this is working towards reconciling your tax subsidies with your return when you do your taxes in 2015. So that's why they'll ask you this question, do you expect this to be the same? If you've gone through a job change lately, or you have, your job is up and down, or you expect layoffs, you might say, I don't know, or you might say, I don't expect it to be the same. I know my unemployment insurance is ending in 3 months and my income will change. And then they are going to ask you specifics about how is it going to change. And they might ask you, what have you made in the last 30 days? They ask that question because Medicaid eligibility is based on your last 30 days of income. So if you are, say, a seasonal employee or you own your own business and the December or January season is not the high point and you had a particularly low income for the last couple months, and you get to that question, you enter in the last 30 days I made this much, which is much less than you usually make, they might kick you over to Medicaid. And in some cases, that's a great thing because people who don't have a lot of disposable income in those years, those lean months, being covered by Medicaid would be really helpful without having to pay a deductible and a premium. And for other people, they know that their income is going to rise in the very next month or 2 months, and they don't want to deal with having to re-sign up on a different program, or they know that by the time they get their card in the mail from Medicaid, their income will be higher and they'll no longer be eligible. So there's a little bit of this back and forth issue. The Affordable Care Act was designed so that the data that you enter into the marketplace would be transferred automatically to Medicaid, and then Medicaid, if you got denied there, could be transferred back to the marketplace.
Okay.
The hitch in this is that what we were hoping would be a 45-day processing time at the Department of Human Services for your Medicaid application, because there are 700,000 more Illinoisans eligible for Medicaid under the Affordable Care Act. It is taking 70 to 80 days is the number that I've heard lately. And 70 to 80 days is almost 3 months. So people are waiting for papers in the mail now that they applied for in November and December, and they're getting anxious and wondering where their numbers are, or where their eligibility information is. They're nervous that if they're denied, they won't be able to sign up before the deadline.
Right.
And so I want to let you know that if you are denied Medicaid, if you've completed an application and you're going to be denied and kicked over to the marketplace to sign up there, the March 31st deadline will not matter. You'll still be able to complete your application after the March 31st deadline.
Now let me just go ahead and highlight that again for everybody. Now we're talking about March 31st being the main deadline. I'm going to put that up on the screen here. Now that represents the deadline to sign up for health care where it does not negatively affect your tax returns. Taxes obviously are in the middle of April. That's the filing deadline for that. And we have March 31st, 2014 is the deadline for signing up for health care or making sure that you're covered if you want to avoid any kind of penalty. But what you're saying is that if you have already been in the process of trying to sign up for Medicaid, and it is a delayed process, you won't necessarily be penalized?
Right. That's specifically for people who have gone through the process. Maybe they started at healthcare.gov, got transferred to Medicaid, or maybe they started at the abe.illinois.gov website, which is Medicaid, and then were denied and transferred over. They won't be penalized. And the penalty really exists for people who are uninsured for over 3 months. From this year going forward, it'll always be if you're uninsured for more than 3 months, you would be penalized in your taxes. But this year, of course, since if you sign up on March 31st within the enrollment period, your insurance wouldn't begin until May 1st. You won't be penalized for the 4 or 5 months that you will be uninsured because it was part of the open enrollment period.
Okay.
And then open enrollment will open again this fall, and anyone can change their plan, change their insurance company, change their doctor at that time.
So just a reminder that if you do have questions about this, if you're stuck in the red tape and you want to understand exactly where you are and what's going to affect you, a good first step is always calling this number here, 866-311-1119. Now, the top of the page there says getcoveredillinois.gov. I'm going to go directly to this website real quick here because I want to showcase just a couple main things here on this website for everybody. Now, Get Covered Illinois, the main page, okay, as it pops up, you're going to see a few drop-down menus. This is a great place to kind of do some research, how to get covered, how to explore different options, get answers. I tend to think that right below Get Answers, you have this FAQ section here, or Frequently Asked Questions. This is actually a really good place to go, whether you represent a small business or you're trying to get insurance for yourself. You can basically click on any of these questions and get the answer to pop up right below it. So if you're not getting any information that you need from today's show, Get Covered Illinois is actually a pretty great website to go and research some of these things. Of course, you could also get started in signing up. Now, there is a basic way where you can pretty much either check out how to get coverage in your area. You can search by zip code. That's also a very easy thing to do so that you can try to keep it local and meet some people who can help you sign up who are close by.
You can also find navigators on the Get Covered Illinois website. They have an events listing of all the places that enrollment clinics are going on. There's probably one near you, and you can call and make an appointment and show up there. Easy as pie.
And this is a good first step, doing research, obviously calling the phone number too. Meeting with a navigator is also very important, but also just kind of understanding exactly what it is that you have to sign up for. Now, there is a penalty if you don't sign up. If you're not caught in the Medicaid red tape and you still don't sign up by March 31st, do you know what the penalty is for this year for individuals?
My understanding is the first year it's $95 or 1% of your income, whichever is greater. And for the next year it'll be $325 per person or 2% of your income, whichever is greater. So it's important to note that when there's a family and the family is uninsured, then that is a per person penalty. So it will be for each individual in the family. I believe the third year it'll go up to the 600s and 2.5% of the income. So it's ramping up as an incentive. This first year there might be more confusion, but then it's ramping up to make sure that everybody gets covered, because the system works when everyone is in the system. But if people abstain, then it doesn't, the whole balance of insurance is off. Insurance is about pooling all your risk together and taking what you need when you're sick and not taking, and then paying into it when you're not.
Right. So just a reminder, today we've been joined by Jessica Palys here from the Campaign for Better Healthcare. I'm going to put your information up one more time here again. And of course, you guys can be reached online at cbhconline.org, or your general number is 312-913-9449.
Yeah, and I'm a navigator as well, so you can call and make an appointment with me.
Okay. And other than that, what are all the things that people could really just kind of call and generally ask you for information about?
They can ask me information about where online, or I can look online while we're talking and find out what kind of premium subsidy they think they would qualify for, or if they would be in Medicaid. If they're stuck, I'm happy to try to help them resolve the issue. All of us navigators in Illinois are pooling all of our information and all of our experiences to find the best ways to help people get through this, because it is an unfolding system that we're figuring out as we go. So if there is a problem that you can't resolve, you can call me. Also, if you have any feedback for the way the system's working, we are communicating through our networks with CMS and trying to always improve the system as it continues. So happy to take that kind of feedback as well. And if the healthcare law is helping you, we would love to hear your stories. We'd love to hear how this policy is actually changing your life. If you found it affordable, if you found it a little tight in your budget, we want to hear those stories as well.
All right. So Jessica Palys, in-person coordinator with the Campaign for Better Healthcare. Thank you very much for being part of our show today. We appreciate you taking the time.
You're welcome.
Especially with the snowstorm coming as it is. It's great to have you come in and fight the elements. Thank you again, everybody, for watching. This has been today's episode of Understanding Healthcare. We'll be back next Wednesday at 4:30, so be sure to tune in again if you have any questions. And in general, have a great week.
Stay dry.
Thank you.